heard about the younger, the median age lowering over time is simply an artifact of testing bias. Before, we weren't testing everyone, and so the population being tested was skewed older. So the younger people are now being tested at a greater rate, and so it makes it look like more younger people are getting infected. And I think that in the coming weeks we're going to see death rates that reflect what's actually happening. Thank you for your time.
Thank you, Mr. Carey. Madam Chair, our next speaker is Gianna, and I'm going to butcher this, Setsmilis. Gianna, if you'll go ahead and give us your first, last name, spelling, address, you'll have 2 minutes to address the board.
Hi, it's Gianna Tesmelis. It's a long one. It's Gianna. Last name is Tsesmelis. Address is 421 85th Avenue, St. Pete Beach, Florida, 33706.
Thank you.
Okay. I have a few things to address. I've been listening to this for on and off for quite some time. The first thing I want to say is that I just graduated as a biology major, so I have quite a background in science. I took a class on prokaryotic biology. I'm going to dental school in the fall. My mother is also an RN at St. Pete General Hospital, so I do have quite a background in this subject. The one thing I want to say about the death curve is that the death curve actually doesn't update until at least a few days after the actual date. So if you look back at the days, it actually is not as seriously declining as people think. Also with masking, I really think that this is the best way to do it because masking is actually very effective if everyone's wearing one, especially when in combination with social distancing, washing hands, reducing travel, and other precautions. We actually have no natural immunity. This is an animal originating virus. And so the fact that people are saying herd immunity will help us or that, boosting our immune system will help us is actually not true. The virus is not afraid of us. It is not a living entity. So I don't know what people are talking about there. And I think it's really disgusting that people are more ready to try an unregulated drug rather than wearing a piece of cloth over their faces, especially the ones that are knowingly positive, which is actually should be considered public safety issue, more specifically manslaughter if they ended up actually killing someone because they knowingly went out and infected someone. Like I said, my mother is an RN. She's been working with COVID since day one, testing people, being around this. She's seen so many coworkers, doctors, ER staff that are getting infected and seriously ill, even with no underlying health conditions.
Gianna, I'm sorry, your time has expired.
That's okay. Thank you very much. Vote yes on masks.
Thank you. Madam Chair, our next speaker is Sara Viola. Sara, if you'll go ahead and unmute yourself, give us your first name, spelling, address, and you'll have 2 minutes to address the board.
Thank you. My name is Sara Viola. I live at 15 North Octorus, Clearwater, Florida. I just wanted to say I'm against wearing the mask. I understand everyone's saying it's a choice and it's a decision, so I still feel like we should be able to have that choice and that decision, whether we want to wear the mask or not, just like how businesses are able to make that decision, whether we go in there with the mask. Again, I just want to say vote no against the mask. Thank you.
Thank you.
Thank you. Madam Chair, our next speaker is Dave Waddell. Oops, hold on, I unmuted the wrong person. Dave, give me 1 second here.
Dave has already been in.
Has Dave spoken on this item already?
Hi, everybody. I'm just going to make this very, very brief. We need contact tracing. That's the only thing that's going to save us, okay? The mask will help, but I want answers from the health department and emergency management. The distribution of the document that I sent.
Mr. Waddell, did you already?
A timeline.
Yes, he already spoke, Brian.
Okay. All right. We're going to go to our next speaker. Our next speaker, Madam Chair, is coming in on the phone line. Last 4 digits, 2830. If you can go ahead and give us your first, last name, spelling, address, you'll have 2 minutes to address the board.
Yes, my name is Jerry Perna. I live in Tarpon Springs. My main complaint about this is people tend to think that wearing a mask is not a big deal if you're going to Publix or you're going to the doctor's office or you're going someplace for a half hour or so. I'm working in an office where they're requiring us to wear that mask 9 hours a day. And at the end of the day, or I should say at the end of 2 hours, I have a headache like I've never had before. My nose is running, the mask is sticking to my face, and I'm getting dizzy. I don't have any underlying health conditions, and that is how the mask is affecting me. I think it needs to be noted that we're not talking about just necessarily wearing a mask for a half hour out of the day. I think it should be thought of that the people that have to work in places that are requiring the masks, and if you put this mandate in effect, everyone's going to require us to wear masks. What about our health? If you want to wear a mask and I don't, I would say you're protecting yourself, so don't worry about me. I'm fine. And I just don't think this is fair. And I think that by listening to the comments today and reading them on the Facebook page, which I have been on since the beginning of your meeting, the majority of the people in Pinellas County are not for the masks. And I hope that as our elected officials, you will take that into consideration and not make this a political move, but an actual decision based on the wants of the citizens. I'm not saying you can't wear a mask. If you want to wear one, by all means, wear it. But I don't, and I shouldn't be told that I have to. Thank you for your time.
Thank you.
Madam Chair, our next speaker comes in on the phone line, last four digits 4656. If you can go ahead and give us your first, last name, spelling, address, you'll have 2 minutes to address the board.
Hi, my name's Amy Cox. I live at 530 Skyview Avenue, Clearwater, Florida. I am a nurse here in Pinellas County, and I would like to give perspective to the current pandemic. I work and have been working directly with COVID patients for the past 3 months in the geriatric population. There are a few points I would like to make. We are seeing an uptick in cases, yes, but no one is bringing up the fact that ACA, the regulatory agency over healthcare facilities, mandating that all patients, all workers in healthcare facilities be tested. There are 496 long-term care facilities in Pinellas County alone. This isn't including assisted living, clinics, or hospitals. Secondly, I would like to address false positives and a false death count, as many patients I've had have had false positives followed by several negative tests confirming false positives, and they pass from other causes unrelated to COVID but are being added to our death count. I would also like to say that even my patients with trachs who are true positive and who are in the geriatric population with several other comorbidities have done well and without issue with this COVID infection. I don't know what's going on in the news as far as reporting, but my own personal experiences as a nurse, that this virus is not what we were seeing on the news. No matter all this info, and no matter the fact that the science continues to change, supporting science on both sides, our government does not have the right to mandate a face covering. We have constitutional rights protecting our right to bodily autonomy. And so I think that makes it clear that I am not in support of mask wearing. And this comes from somebody who works doubles, 16-hour shifts back to back, working directly with COVID. Thank you for your time.
Thank you.
Madam Chair, our next speaker is Kelly Johnson. Kelly, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Yes, hi, I'm Kelly Johnson, KELLYJOHNSON. I live at 571 Shady Grove Drive in Dunedin. And I would like you to vote yes on support of wearing masks. I know everybody has their own opinion based on their own personal experiences. Mine comes from having to be home, furloughed, and with children. If we don't get a hold of this thing, we're just going to continue to have to shut down and not let the kids go to school, things of that nature. It's not just going to magically go away. I really think it's time for us to be proactive and go ahead and do some things that may be a little bit uncomfortable for a little while, but in the end, it'll result in a much better Pinellas County for us. When DeSantis started his phase reopening, he continued to refer that he would watch the numbers, and if it didn't look good, he wouldn't open the next phase. He didn't do that, and I'm really sorry that our county now has to do their own thing. And I really would like you to just consider the big picture in this. I'm not happy wearing a mask either. It makes me nauseous. But I want my life to return. I want to be able to get back to work and my kids to get back to school. And I think that that's the only thing we can do at this point is wear masks. Thank you for your time.
Thank you.
Madam Chair, we have 15 remaining speakers. Our next speaker is Jeff Dupuis. Jeff, if you'll go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes to address the board. Jeff, you'll have to unmute. Jeff? Okay, we'll move to our next speaker. Madam Chair, our next speaker comes in on the phone line. Last four digits 3494. If you can give us your first, last name, spelling, address, and you'll have 2 minutes to address the board. Hello?
Hi, can you hear me?
Yes, ma'am.
Oh, great, thank you. Please, I'm asking all of you to please listen to the health experts and vote in favor of the mask ordinance. I have asthma. I wear a mask. It doesn't bother me.
Could you say your name, please?
Oh, I'm sorry. Sure. It's Laura Clark, and I live here in Clearwater for 35 years.
Thank you.
To the woman who just screamed at everyone, yes, I'm concerned about your health and my health too. Don't psych yourself up into a rage. Breathe normally, remain calm. That goes for anybody wearing a mask who hates it. It's just, it's uncomfortable sometimes, but we have to do what we have to do. HIV and other diseases are not transmitted the same way COVID-19 is transmitted. You don't have to have intercourse to catch it, for the woman who said it was comparable to getting HIV. To address another caller, wearing protective masks is part of the solution. Since April 20th of this year, the state of Connecticut has had a mask requirement, and they currently have the lowest rate of coronavirus transmission in our nation, going from a very high level. Look to other states as models for what has worked and what has not. There shouldn't even be any question that we as human beings should show basic respect and decency in the middle of a medical crisis for each other. How is this even a question? We all know that this disease is easily transmitted, and wearing a mask is one of the simplest and easiest ways to slow the spread and save lives. So I'm just asking, please, please save lives. It's not hard. It's not uncomfortable. It doesn't hurt you. Grow up and put on the mask. And shame on you, Sheriff Bob, for your lack of concern for the people of this community. Please, everyone, don't be a danger. Please protect each other. Thank you for your time.
Thank you, ma'am. Madam Chair, our next speaker also comes in on the phone line. Last four digits 0473. If you can go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes to address the board. Hello? Hello?
Oh, hello?
Yes, ma'am.
Hi, I'm Compass. I'm 9. First of all, kids are not germ factories. No one is sterile. We all have immune systems that we need to fight viruses. So I choose to boost my immune system by not eating junk food and being outside with the sun and breathing fresh air and not cotton particles from a mask. Stop believing in fake science.
Thank you.
Thank you.
All right, Madam Chair, our next speaker is Diane Lebedeff. Diane, if you can go ahead and unmute, give us your first, last name, spelling, address. You'll have 2 minutes.
Sure. Diane Lebedeff, L-E-B as in boy, E-D as in David, E-F-F as in Frank.
Thank you.
101 South Bayshore Boulevard, Safety Harbor. And hello, commissioners. I'd really like to just testify in favor of a mask requirement. There is absolutely no legal reason why a public safety provision like a mask requirement cannot be imposed by the commission. And this morning I listened to the presentation of Dr. Jamesman and his companion on the Pinellas government website about the coronavirus. There is no doubt that it is going to get worse. And I think it's incumbent on you to impose a mask requirement so that the public health can be protected and so that we can get a grip on this and so that it doesn't inflict serious damage on the citizens of Pinellas. And it's not just getting sick temporarily. There are also signs that there can be permanent physical damage to organs, to circulation, to lungs, neurological systems. So it really is a horrific cascade of events that can occur for the people of Pinellas. And a mask requirement is the simplest way to deal with it. Thank you very much.
Thank you.
Thank you, ma'am. Madam Chair, our next speaker comes in the phone line. Last four digits 6191. If you can give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hi, my name's Gloria Lindenberg. It's Lindenburg. I live at 314 Indiana Avenue in Crystal Beach, Florida. And I was just calling to say that I am in favor of requiring masks. I do have asthma. Otherwise, I'm healthy. So when I go out in public, my health depends on everyone else. And even though I know that just me wearing a mask isn't necessarily just protecting me, but I feel like I could have the virus and I don't want to give it to others. I am really alarmed at the growing rise in infections, and I see younger kids that think they're invincible together at the beach, at bars, and sometimes you just have to step in and say, this is what you're going to have to do. And I hope that you vote yes. And thank you for your time.
Thank you, ma'am.
Thank you.
Madam Chair, our next speaker is Barbara Walker. Barbara, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll get 2 minutes.
Hi, it's Barbara Walker. I did speak before 3019 Bradford Circle in Palm Harbor. I didn't probably take up my whole 2 minutes. I just wanted to say, I think it's extremely important that you vote yes to stay in alignment with Tampa and St. Petersburg. We need to be consistent throughout the region. Thank you.
Thank you, ma'am. Madam Chair, our next speaker is Antonia Green. Antonio, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes.
Hi, my name is Antonia Green, Antonia Green, Green, 13561 Forest Lake Drive, Largo. Thank you for hearing me today. I am urging you to vote in favor of wearing masks. I'm a librarian in Pinellas County. I'm a parent of 2 young children, and their health and the health of my patrons is definitely the forefront of my mind every day. This is not something where we can develop a herd immunity. It does not infringe on anyone's rights to wear a piece of fabric over our faces. It's just a minor inconvenience to citizens. Since we started this return to normal, I've seen people ignoring masks and social distancing, both in libraries, grocery stores, pretty much anywhere where people are gathering. And it's just a flagrant disregard for the well-being of our fellow citizens. This virus is not going to disappear overnight. We really need to come to grips with that reality. And I'm willing to wear a mask at work, in public, for my safety and for yours. And I really do expect the same from my neighbors. Thank you.
Thank you.
Thank you, ma'am. Madam Chair, our next speaker is Robert Salta. Robert, if you'll go ahead and unmute, give us your first, last name, address, spelling, and you'll have 2 minutes to address the board.
Hi, my name is Robert Salta, spelled R-O-B-E-R-T, Salta, S-A-L-T-A, and I live in Gulfport, Florida. I'm a licensed attorney, and I've actually studied and written about constitutional law. And personally, it has me scratching my head at the complete lunacy of the idea that a mask is unconstitutional. It's the same laws that require a restaurant to refrigerate their chicken. No matter how hard a restaurateur believes that they don't need to refrigerate chicken, the chicken will rot. And if it's served to the public, it will infect the public. Your individual rights have always ended when you're causing harm to the public. You cannot use your speech to start a riot. You cannot use your Second Amendment to shoot someone. You can't decide to forego clothing because you believe it infringes on your constitutional rights. You are free to not wear a mask in your own home, and no one will judge you. Just as no one is forcing you to wear clothing while you're in your own home. See, the idea of a society, the idea of a state, is that we came together with the purpose of protecting one another. This has been going on for 10,000 years. And whether it be in the ancient world against barbarians or in the present day against a pandemic, the goal stays the same, and that's to protect one another. Over the past 3 months, we've lost over 100,000 citizens. That's the equivalent of experiencing 10 September 11ths every month for the past 3 months. If that had happened, we'd be listening to the generals, we'd be listening to the military leaders, how to respond, how to protect ourselves. Those best suited to protect themselves in this situation are the doctors and the medical professionals. And they're telling us that masks work. They're telling us that masks are the simplest solution that can lower this death rate. And we have other countries that have used these masks, and they have practically eradicated the pandemic. New Zealand hasn't had a new case since June 8th. They have a population of 3 million, which is smaller than that of Pinellas, and they've eradicated completely. No new cases since June 8th.
Mr. Salta, your time has expired.
Thank you very much.
Thank you,
Thank
sir.
you.
Madam Chair, our next speaker comes in on the phone line. Last 4 digits, let me see here, 3084. If you'll go ahead and give us your first, last name, spelling, address, you'll have 2 minutes to address the board.
Hi, can you hear me?
Yes, ma'am.
Hi, this is Danielle Sheeler, Daniele, last name Sheeler, 1396 Bellevue Boulevard, Clearwater, Florida. I'm imploring you all to please vote yes for wearing masks. I am in healthcare, been there for over 20 years. I have to wear an N95 mask all day. When I go to the store or go out in public or do anything like that, I still keep my mask on because I care about my own health, as well as everyone else that's in the vicinity of me. To hear some of these selfish comments coming from people saying that they don't need to wear a mask or they shouldn't have to wear a mask, and that if I want to wear a mask, that's all right for me, but if they're not able to do it, then too bad, is really very selfish. And I think I want to protect everyone, but the people that are complaining about not wanting to protect each other is very disheartening. You've got to do the right thing here. I implore you all to please follow the lead of other great counties such as Miami-Dade and Hillsborough County. Pinellas County is a fantastic county, and you need to do the right thing here and step up and be the leaders that we voted you in for, and the leaders that we hope that you continue to be. So thank you very much for your time.
Thank you, ma'am.
Thank you.
Madam Chair, next speaker is Carl Conyers. Carl, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes.
Yes, this is Carl Conyers, Karlconyers. I live at 1799 La Grande Drive in Dunedin. I am not a licensed attorney or an educator or a healthcare professional. I am just an everyday citizen. But and I hate to sound like a broken record. I know you've heard this argument all day, but I do urge you to vote in favor of, face masks in the public. I think about people that are other than myself, which is something I'm constantly having to remind other people of, that this is not about the individual. This is about protecting all of us. I'm sure you know that. But it is something I have to remind my friends and family of quite often. I'm 22 years old. Being a member of the younger population, I see my fellow friends out without masks, pretending like this is not a problem. The thing I have to remind them of is that we do not have an end in sight for this. There's no cure. There's no vaccine. We need to act like it, and we need to act like this is the crisis that it is. That also said, about thinking about other people until we see a downward trend, I think it'd be right to be wearing masks. And, to the person that said that this is a political discussion, I vehemently disagree with that. This is a matter of public health. It should not be left versus right. It should be people versus the virus. And that's all I have for you.
Thank you, sir.
Thank you.
Madam Chair, our next speaker is Phil Gozo. Phil, if you'll go ahead and give us your first, last name, spelling, address, you'll have 2 minutes.
Hi, it's actually his wife, Kathleen.
Oh, okay. Sorry, Kathleen.
I'm calling in on his Zoom. It's Gozo. I'm 100% for mandating the masks. I'd like to be able to see my parents who are in their 70s be able to go out and about without fear of getting the infection. I also am autoimmune, and I don't think I should be punished for that. So it's not violating anybody's right. You go into a store, you have to wear your shirt, your shoes. I mean, come on, guys. And you know what, Sheriff Bob? Shame on you. Really, pay attention. I've been watching you roll your eyes. If it's too hard to take drunks out of an overcrowded bar, what do we need you for? I mean, literally, it's common sense. Wear a mask. That's it. And I've been watching all of you. And except for Mr. Welch, you look like you're so bored. You take tax money from people in Pinellas, and you're going to be bored when we try to tell you what we feel? Shame on all of you, except for you, Mr. Welch. Thanks so much for your time. We need masks. We're on the rise.
Thank you.
Thank you. Madam Chair, the next speaker comes in on the phone line, last 4 digits 9632. If you can go ahead and give us your first, last name, spelling, address, you'll have 2 minutes to address the board.
Good evening, everyone. My name is Michael Leibovitz, Lebovitz. My address is 2199 Chianti Place, Unit 912, Palm Harbor. And I am calling in favor of masks. I myself am a behavior therapist. I work with an endangered population. I have type 1 diabetes. My wife also works in healthcare. And we cannot ignore the danger that people like myself with chronic illnesses are in. And we cannot ignore the danger of our clients. For my wife, nursing home, assisted living population, and for myself, kids with varying diseases and disabilities, and all of their families as well. Lastly, I would like to make an economic argument here. Wearing masks encourages economic growth. People can go out, they can feel comfortable and safe wearing a mask. Not wearing a mask makes people feel scared, uncertain, like their lives are in danger, and for some of us, they are. And the sooner that we wear masks, the sooner that we all conform, the faster we can kick this thing, and the faster we can get right back to it. Thank you very much. That's all I have to say.
Thank you.
Thank you, sir. Madam Chair, our next speaker comes in, let's see. I've got Moto Play. I'm not sure. You have to give us your first, last name, address, and 2 minutes to address the board. Can you hear me okay?
You hear me?
Yes, ma'am.
I'm calling from my home in 812 East Gulf Boulevard.
I'm sorry. Can you give us your name one more time? We didn't catch that.
Echo Thomas, ECHOTHOMAS, calling from 812 East Gulf Boulevard, number 5, Indian Rocks Beach, Florida, 33785.
Thank you.
I'm calling to encourage all of you, as I have in emails that I've written you, to trust the scientists and the experts on this issue. I am 26 years old. I live with an autoimmune disease, which means that my immune system doesn't work as well as it should. I also live with my mom, who has the same autoimmune disease and a recovering cancer survivor, and a father who's a teacher at a Pinellas County middle school who has asthma. We absolutely cannot keep living life as normal when our fellow citizens and our neighbors are dying. So the worst that can come from this is that if we don't wear masks, the numbers continue to rise and we see more loss of life. The worst that can happen if we do wear masks is that some people will be inconvenienced temporarily for having to wear one. I myself get very fatigued and out of breath very easily, but I still make a point to wear a mask as a courtesy, not only to protect myself and my family, but protect everyone else and their families as well. So I encourage you, please do not let this become a bipartisan issue, but trust the facts and the science. Please vote yes to mandate masks in Pinellas. Thank you.
Thank you.
All right, Madam Chair, we're back up to 15 remaining speakers. Our next speaker is Melanie Fort. Melanie, if you can go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hi, my name is Melanie Fort. I live in Gulf Boulevard on St. Pete Beach. I'm a 21-year-old college student. I had my senior year last semester, and I missed a lot of things because of this virus. And I'm literally the epitome of a healthy person on book. I've never had anything, never had to go to the doctor for anything bad. The worst thing I've had was a strep throat because I was a singer. And I still am wearing my mask every single day. I don't leave my house unless I really need to. I'm 21 years old, so when people say that young people are avoiding this, I do understand because I do see my fellow people like me ignoring it, but it's not all of us, so it would be really nice to not generalize us. I'm disappointed in my fellow citizens for the way that they are responding to all of this, and the commissioners and just the people in charge. The fact that we have to have this conversation is really disheartening because we have seen other countries and states do what they have to do and have strict rules in order to make sure that their citizens are safe, and it's working. And the fact that we have to have this conversation to allow people that are against it to share their voice is kind of disappointing. I love the analogy of having to wear clothes. Like, I don't like wearing pants, but you see me wearing pants because I'm not going to walk around naked. You know what I'm saying? Doctors are saying to wear masks, and officials are saying that this is the bare minimum of what we can do to prevent it. So to go against that and to say that that is taking away your rights is really annoying when there are Black people that are dying and they are getting tormented by the police. And that is pretty much the epitome of getting your rights taken away. If you don't want to wear a mask, then you can stay home and order your groceries online. We are in 2020 that you can literally order anything and everything to your house. So if you want to be selfish, please stay home because you are literally committing attempted murder, basically, because if people are coughing on each other, people are not respecting social distancing, that's literally an assault, basically. And I know that sounds crazy, but it literally is just the truth. Mr. Welch, I love your background. I love your bow tie. You are a king, and I am very hopeful and inspired to see somebody like you on this board. Thank you for listening. Please do the right thing because I'm really worried for my generation and the people above me and below me. Thank you so much.
Thank you.
Thank you. All right, Madam Chair, we have 17 remaining speakers. Our next speaker is Jennifer Harmon. Jennifer, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes.
Excuse me, my name is Jennifer Harmon, JenniferHarmon. I am in favor of the masks. I drive home through downtown Dunedin. Sorry, I'm at work. Downtown Dunedin, and I see tons and tons of people crowded together. I'm sure that all these hundreds of people are not from the same family, and no one is wearing masks. No one is social distancing. And I go to work and I go home. And at work, I require all of us here to wear masks when we deal with the public. Inside the building, there's only a few of us, so we're not that close to each other. We all have our own phones. We're being very careful, but to see massive amounts of people, all ages, small children, elderly people, crowded downtown Dunedin on a Sunday afternoon or Friday night or Saturday night, it just makes me sad that people, I mean, if they're not forced to do it, they're not going to do it, period. You know, people are not going to be careful.
Thank you, ma'am.
Okay, thank you. Brian, can I just cut in for a second?
Sure.
I know that a couple of our guests are going to have to leave soon, Sheriff Bob and Dr. Cho. I thank you, Dr. Jamesman, for being here all afternoon, but I just want the public to know that they're not leaving because they don't want to hear you anymore. They're leaving because they need to go somewhere else. They have other meetings to attend. This is well beyond our normal meeting time, so we appreciate you being here, and just leave whenever you need to.
All right, Madam Chair, our next speaker is Jennifer Stracick. I probably butchered that. So Jennifer, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Good evening. Jennifer Stracick, JenniferStracick. And I am here on behalf of Alpha House of Pinellas County. We are a homeless shelter for women and babies in the community who are abused and or human trafficked. And I just wanted to go on record to say that I support the use of masks at all time. We struggle on a daily basis to keep COVID out of our home. We've been successful thus far, but we have newborn babies, teens, adults, and it's very scary environment. We only take them to the grocery store every week. We don't take them anywhere else. And even in the grocery store, it is such an undertaking to spray everything down, additionally what the store is doing, and to basically dodge people in aisles that choose not to wear masks. So I thank you all for everything that you're doing for the community, and I just wanted to be on record that we support having masks on all the time. Thank you.
Thank you.
Thank you. Madam Chair, our next speaker, I only have a last name for it. It looks like Katsaros. If you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board. And you'll have to unmute, ma'am or sir.
Someone with that last name has already spoken to
Yeah, I seem to remember that as well, Madam Chair. We'll go ahead and go to the next caller. Our next speaker is Alexandria Johnson. Alexandria, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes.
Hello, my name is Alexandria Johnson, Alexandria. My last name is Johnsson. I live in Tarpon Springs, Florida. I lived here since I'm 21 now, and I lived here since I was 4, so 17 years. I have a little sister, and she is 5 years old, and she's fighting leukemia right now. So she's at very high risk if she were to catch the coronavirus. So I think it's very important that everybody wears their face masks. It's not that big of a deal to wear a face mask for 30 minutes while you're in the grocery store, or a few hours if you choose to go to a restaurant or something. Because of people like me, where I can't leave the house to hang out. I can't leave the house to go to the beach. I can't leave the house to go to a restaurant. I can't hang out because I can't put myself at more risk. So I literally only leave the house for essential things. So if I'm trying to go get some groceries so I can eat, I'd like to be able to go there with peace of mind, knowing that I won't be at risk for catching the virus and bringing it back to my 5-year-old sister who could die from the virus because she has leukemia. So I highly encourage that we implement the laws for people to wear face coverings. Thank you.
Thank you. Madam Chair, our next speaker is, I just have a last name, Yasova-zaffos. You'll have to go ahead, unmute. Give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Yeah, good morning or afternoon. Wow. My name is Yasova-zaffos. Last name is spelled on there. It's Yasova-zaffos. We're in Seminole, Florida. As a healthcare professional, we have had the unfortunate reality of seeing how this unfolds, not only in the hospitals that some of us work in, but also those that our loved ones work with. This is a healthcare crisis, and these decisions should be made by healthcare professionals. These should not be political discussions. The fact that this is up to public discussion is asinine, to be frank. We have a responsibility to protect our communities. That's your job as our elected officials, to protect our communities, when clearly those amongst us will not do the right thing unless they are required to. There are a lot of individuals who do not have the luxury to work from home, whose livelihoods and their families' livelihoods require them to go to work. So they have the responsibility to have to be in contact with all of these irresponsible and selfish individuals who do not want to mask themselves to prevent spreading the disease. There are plenty of asymptomatic and pre-symptomatic people spreading this disease, and you have the responsibility to keep your community safe. Do the right thing, vote for universal masking, listen to your healthcare professionals. This is not a decision that any of us in the community should be making. It's a decision that strictly the experts should be making.
Thank you, ma'am.
And again, if I could break in on that one, we are not just required to listen to the public if they want to make a comment on something we're going to be voting on, but we believe it's a central part of our government. We need to hear from the public. We will be listening to our health professionals when we make this decision. But I appreciate you calling in. I appreciate everyone that's called in so far. And when we stop getting calls, we will make a decision.
So, Madam Chair, we have approximately 11 remaining speakers. Our next speaker is Joshua Ellis. Joshua, if you'll go ahead and unmute, give us your first, last name, spelling, and address, and you'll have 2 minutes.
This is Joshua Ellis, Seminole, Florida. Yeah, I mean, I think there's a positive to wearing the mask. I think we should be cautious. I think it should be left up to the parents if the children wear the mask. I don't have much comment. I work in healthcare. I get it. We wear the mask. I don't like the fact that we're imposing it on citizens. I don't like the fact that we're adding, especially during the civil unrest that we have in our country right now, that we're adding this extra burden to our police officers. Sheriff Bob, I really appreciate, our family really appreciates the effort that you and all of your men do every day, as well as all of the other police departments around Pinellas County. I understand there's a difficult decision here. I do appreciate the time. Thank you for the time.
Thank you.
Thank you, sir. Madam Chair, our next speaker, I don't have a name. It just says veteran. So if you'll go ahead and unmute yourself, give us your first, last name, spelling, and address, and you'll have 2 minutes to address the board. And you'll have to unmute yourself in order to address the board, please. Hello? And Madam Chair, looks like we're unable to have this person for whatever reason, so we'll go to the next caller. Next caller is Daniel McAllister. Daniel, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes.
Thank you, ladies and gentlemen. My name is Daniel McAllister, DanielMcAllister, and I live at 5228 Carlsberg Place in unincorporated East Lake, the northern section of the county. I'm a lifelong resident of Pinellas County, born at Mountain Park Hospital in 1969 in St. Petersburg. Raised here my entire life, raised in Largo, a graduate of Largo High School, proud father of 9 children, most of whom were adopted from the foster care system here in Pinellas County, and proud father of 7 of 9 of them who've already graduated from Pinellas County schools. I asked to speak today very briefly in support of requiring some kind of source control measure for the spread of the COVID-19 virus, whether that's the masks that everyone is talking about, but I would also ask that you consider an alternative of a face shield. Reports are generally supportive of the fact that that equally will support the concept of blocking the spread of the virus. And it is an alternative that people that have respiratory issues can use without blocking their ability to breathe in. And that's all I really have to say. Thank you for the opportunity to speak.
Okay, thank you.
Thank you, Daniel. Madam Chair, our next speaker is, let's see here, we need Zach Stephenson. Mr. Stephenson, if you'll go ahead and unmute, give us your first, last name, spelling, and address, and you'll have 2 minutes, I'm sorry.
Hi, thank you. My name is Zach Stephenson. I live in St. Petersburg, and I just wanted to say, you know, as someone who works in healthcare, as a husband of an immune-compromised cancer patient, and as someone who's actually survived COVID, I'm frankly disgusted that we're even having the conversation right now. I mean, it seems like a no-brainer to wear masks. You know, we as a society should care for the least of these. We should care for each other. Wearing a mask isn't really an issue of your personal health. It's an issue of the health of your neighbor, of your friends and family. You know, scientific studies have proven that wearing a mask is far more effective at preventing spread than preventing infection. And just to kind of, you know, talk to some of the points people brought up about the mask being uncomfortable. You know, like I said earlier, I've survived COVID. I was in my bed, unable to breathe for 4 weeks, and it's far more uncomfortable.
Thank you, sir.
Thank you.
Thank you.
Madam Chair, our next speaker is Cindy Churchward. Cindy, if you'll go ahead and unmute and give us your spelling, first name, last name, and address, and you'll have 2 minutes to address the board. And Cindy, you'll have to unmute.
Hello.
Hello.
My name is Cindy Churchward, Churchward, and I'm live at 1730 Sherwood Street, Clearwater, Florida. And I'm looking at the basic facts. First, I want to say thank you, Sheriff Bob. Thank you for standing up for our constitutional rights. And also thank you, Karen Seal, for looking at the really hard questions. We were doing fine in Pinellas County. We were leveling out until the kids started protesting and started going back into the bars. I think we need a lot more tracing to find out where it's coming from. And it spiked up, and from what I understand, the last few days, it's headed back down again. I do not think we're in any type of huge catastrophe emergency situation when 99% of the people survive. COVID is here to stay. It will be here 10 years from now. It will just continue to mutate, and even the vaccines won't work, the same as the flu. So we have to practice social distancing. I, for one, I have immune compromised system. I'm on disability, and yet I social distance. I go out without a mask. I cannot breathe with a mask on. I don't know how any other way to say it with asthma. I cannot breathe with it on. My daughter works in healthcare. I know your testing has had to go up recently because she works in a long-term facility that just started getting tested 2 weeks ago. So if that's the case around the county, your numbers will be spiking. Anyway, I appreciate your time. I urge you, please do not make this mandatory. Anyone who wants to wear it, great. Hats off to you. If I'm around somebody that's really closely immune compromised, I try to wear it as best I can, but I can't breathe in it. I literally have to pull it out from my face.
Thank you, ma'am. Your time has expired.
Thank you.
Madam Chair, our next speaker comes in on the phone line, last 4 digits 0473. If you'll go ahead and unmute and give us your first, last name, and spelling. I'm sorry, let me unmute real quick. Can you give us your first, last name, spelling, and address, please? And then you'll have 2 minutes.
Hi, my name is Devin, and I'm 11 years old. And to all of the callers with asthma, just because masks don't affect you doesn't mean it doesn't affect others. It gives me asthma attacks, and Halloween masks do the same, and I can't wear them. vote no for my safety. Thank you.
Thank you. Madam Chair, our next speaker is, let's see here, Barbara Walker. Barbara, if you'll go ahead and unmute, give us your first, last name, spelling, and address, and you'll have 2 minutes to address the board.
Okay, it's not Barbara. We have other household members that wish to say something.
Okay.
Please go ahead.
Hi, I'm Lonnie Walker, LANIWALKER. I live in the Palm Harbor area, and I think we should have masks on. I think it should be required, because when you're walking around the grocery store, just even if that's the only place you go, you don't know who there has a family member who could be compromised. You don't know who there is compromised. And it's just like, and I'm totally for, like, if there's an alternative, like a face shield, like just anything is better than nothing. And I don't think like people should just be walking around without that kind of protection for themselves and for everyone else. It's common sense.
Thank you.
Thank you.
Let's see here, Madam Chair. Our next speaker is on the phone line, last 4 digits 0790. If you'll go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes.
My name is Michael Ferdovich. I'm Vice Mayor of Gulfport, 5325 11th Avenue South, Gulfport. I'm in favor of the masks, and I think we should require all masks. People should wear masks, whether you're an employee or visiting a store, or restaurant, etc. I mean, not a restaurant, obviously, but when you go into an establishment. The absurdity that it's unconstitutional is ridiculous. I don't like wearing a seatbelt, but I have to wear one. So that constitutional situation is an absurdity. So anyway, I suggest you vote yes on requiring masks. Thank you.
Thank you, sir. Madam Chair, we have 8 remaining speakers. Our next speaker is calling in on the phone line also, last 4 digits 7900. If you'll go ahead and give us your first name, last name, spelling, and address, and you'll have 2 minutes.
Hi, my name is Miles Katsaris. I apologize. I called in on my tablet, but I had internet issues and it kicked me off. I'm in the Palm Harbor area, and I'm a 7th grader in Pinellas County. I struggle with anxiety like many others do. I had a school project which required me to educate myself on COVID, and I'm particularly interested in what it will be like going back to school. I have not heard anyone say anything about mental health, and it is a very important topic to address. Do you know how much anxiety this has caused children? While I am wearing a mask, I am in serious danger. How is this more dangerous than secondhand smoke? Should I have anxiety that I will die from that too? So smokers do not care my health, or they would not be smoking. What are you going to do about that? I also want to thank Ms. White for giving me the opportunity to speak when Madam Chair didn't care to hear me. Thank you.
Thank you,
Well, I
Miles.
can assure you that I wanted to hear you. We just couldn't get you here. We have not listened to anybody that called in.
Yeah, that's definitely true. All right, Madam Chair, our next speaker is Katie Jamesman. Katie, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board. And Katie, you'll have to unmute yourself.
Oh, okay.
There,
you can hear me now.
there you go.
Hi, my name is Katie Jamesman. I live in the Clearwater area around Gulf Bay and Belcher. I'm 27 and I do have an autoimmune disease. I'm calling because I am in favor of face mask, and I do think that it should be mandated because nobody else is going to do it apparently. I do have friends in my age range, and I clearly see them going out and about and not caring about anybody else besides themselves. So I see a lot of that already. I think that a face mask is just an inconvenience, and if you can't wear one, then don't go out. I mean, the people that are going out right now should be the ones that can, take care of others and not just themselves. So thank you.
Thank you.
Madam Chair, our next speaker comes in on the phone line, last 4 digits 4341. If you'll go ahead and give us your first, last name, spelling, address, you'll have 2 minutes to address the board.
Hi, my name is Kelly Edwards, Kelly Edwards. I'm in Tarpon Springs, Florida, a lifelong Pinellas County resident. I take great pride in how I've taken responsibility of my own health over the years. I work hard at bettering my health every single day. This is in regards to the foods I eat, the water I drink, working out and exercising regularly, the products I use on my body, etc. That being said, as a healthy 37-year-old woman with no underlying medical conditions, I strongly oppose wearing a mask for myself and my young children. I absolutely oppose mandating masks or any other medical procedure for that matter. It is important to allow citizens to make the choice on whether wearing a mask is beneficial or actually protecting themselves and others. I am a small business owner of a gym and think it is detrimental to people's health and well-being to wear a mask while working out, and have questions on how this would affect my business and income. Please vote to uphold our health and medical freedoms and parental rights and allow us to make the choices that we feel is the best fit for us individually and for our families. Thank you.
Thank you.
All right, Madam Chair, we have about 5 more speakers here. Our next speaker comes in on the phone line, last 4 digits 5612. If you'll go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes.
Hi, can you hear me?
Yes, ma'am.
Yes. Okay, my name is Kristen Ward. I am actually a resident of St. Petersburg, Florida. I'm actually studying a master's degree in public health administration. So I am all in favor for face masks. I think you guys are doing a great job, and I would appreciate it if you voted yes on face masks. Thank you for your time.
Thank you. Madam Chair, our next speaker, I don't have a name for, CVerkuilen. If you'll go ahead and unmute yourself, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hello, my name is Christopher Verkuilen, CHRISTOPHERVER, capital KUILEN. Address is 1014 Bella Vista Drive, Northeast, St. Pete, Florida. So my comment is, we've asked for this information before. If you're going to impose these kind of policies, you need to have a measurable reason to implement it, a measurable point at which it will be retracted. We haven't had an increase in cases, yes, but your chances of running to a person with COVID in Pinellas County are less than 1 in 4,000. This is nothing to say of your chance of contracting it from that person, which is around 1%. Mark my words, this order will not stand the scrutiny of the court. The lawsuit that will come to Pinellas County, and you will lose it. It's expressly against the U.S. and Florida constitutions, and the law will decide as such. If you decide to wear a mask, perhaps you should choose a device that is actually capable of protecting you, so you don't need to force others to wear a device. This order will penalize those who don't wear masks, but those who wear face coverings, yeah, I said face coverings, because many devices in the public wears will provide absolutely zero protective value. In fact, it can have a negative effect because of facial touching. Yet these individuals wearing fashion-grade masks will be complying with the law. The WHO has said masks are ineffective, but they retracted their statement due to political pressure. So I urge you to not enact a facial covering law. Thank you.
Thank you.
Madam Chair, our next speaker is Leah Walker. Leah, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes.
Hi, my name is Leah Walker, and I am at 3019 Bradford Circle, Palm Harbor, Florida. My name is spelled Leahwalker.
Thank you.
I've suffered from mental health issues for the majority of my life, and originally masks gave me panic attacks, and I had to overcome that. And even being on this call creates immense anxiety, but I thought it was so important to just urge people to do the right thing and wear the mask, if not for you, but for someone you love or someone you don't even know. We should be united together right now in protecting each other. And it's really just a no-brainer to me at this point, you know, as an essential worker and a new voter, we should be wearing the masks.
Okay,
Thank you, Leah. Madam Chair, our next speaker is Steve Pizzano-P, and I probably butchered that. So Steve, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes.
Hi, I'm actually a first responder, so I'd like to say, first of all, I really think you do need to vote this in because of the number of cases I've actually ran and been exposed to. And my fear is bringing it home to my family, my in-laws, and all that stuff. So definitely need to vote it in. It's the point I won't even let my family during the whole lockdown, would let my family go out. I was the only one going out getting stuff. So yes, you definitely need to vote this in. People are going out there without the mask, exposing themselves and all that stuff. I don't know why they would even want to take that risk. So yes, most definitely, you do need to vote this in.
Steve, just for the record, can you give us the spelling on your last name, sir?
Pizzano.
Mm-hmm.
I don't use the other part of it.
Okay, thank you. I appreciate it.
Thank you.
Yep.
All right, Madam Chair, we have next Rich. I do not have a last name, so Rich, if you'll give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hi, yeah, my name is Rich Graham, Graham, and I live in Seminole up off of Park Boulevard. And I know this entire thing is politicized one way or the other. Doesn't matter where we fall. We have very strong opinions. Personally, I'm against it. I would much rather us have the choice rather than being mandatory. But I would ask that in this time of all this other craziness going on in other areas locally and around the country, that if we pass this, what will be the restrictions on those who can legally and lawfully carry a concealed weapon if they're also required to wear a face mask, especially for those of us who have young families and we don't necessarily want to go out in public without the ability to just, there's dangerous situations at times and they come up out of nowhere. So what is that restriction or clause going to look like? Thank you.
Thank you. And I think that one's already been answered, but go ahead.
Madam Chair, our next speaker comes in on the phone line, last 4 digits 7780. If you'll go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes to address the board. You'll have to unmute. Hello, can you hear us? Yeah, I think we're gonna have to move on to the next one, Madam Chair. We had the remaining speakers, Madam Chair, were all ones that we had technical difficulty with. Do you want me to try going through one? Just to,
can try them real quick.
we'll try them real quick, and we'll try Ryan Thompson. Ryan, if you'll go ahead and unmute.
Can you hear me this time?
Yeah, now we can hear you. How are you, sir?
Oh, I'm good. Thank you for being patient and listening to everybody today. Ryan Thompson, RyanThompson, and I live in 33756, which has the most cases outside of St. Petersburg that already has a mask ordinance. Maybe it's better that this happened towards the end of your call, because what I wanted to say to you guys especially is Albert Einstein once said, what is right is not always popular, and what is popular is not always right. When I first called over an hour ago, you guys were getting inundated with people telling you that you were doing the wrong thing by having masks. And I want to thank you guys for listening and hopefully passing this mask. So please don't worry about your reelection. Do your promised duty. I only wish that you guys would have followed Tampa and St. Petersburg and voted on this last week and maybe saved how many number of people from getting it over the weekend. On May 23rd, we had 1.4% positive rate on any of the tests that were taken. According to testimony here today, we have 14%. That's a huge amount. Everyone calling and saying this is just due to more testing is not looking at the numbers. We went from 1.4 to over 10%. According to the state plan for reopening, we are now above the required level to continue our phased reopening at over 10%. That's one of the required 3 things that we have to pay attention to. If we don't get below 10%, we cannot continue reopening. All other areas in Tampa Bay are forcing masks, so people will flock to Clearwater and the rest of Pinellas County and Gulfport when they can't not wear masks in Tampa and St. Pete, causing a higher rate for citizens here near me. For people saying there's a constitutional issue, there's no further restriction than a sign that says no shirt, no shoes, no service. It's the same thing. It's just requiring a little bit to protect everybody around you. The Constitution promises life before liberty for a reason, life and then liberty. Those are the ways those are the in order that the Constitution promises. So please vote the most restrictive and comprehensive version that removes all loopholes and find ways to close any loopholes, because a large portion of the population cares more about political viewpoints than keeping us safe. Please do the right thing.
Thank you.
Thank you, Ryan. Madam Chair, our next speaker, we'll try Ann Hutchinson one more time. Ann, if you'll go ahead and unmute yourself.
Hi, can you hear me this time?
Yeah, now we can hear you. How are you, ma'am?
Fine, thank you. Ann Hutchinson, Common Spelling, Clearwater, Florida. And I first want to thank Sheriff Bob. I think he has the most